Hi there, my name is Dr. Marcy Zwelling. I'm a physician here in the Long Beach and Los Alamitos area, and I want to talk to you about genetic testing. Who should be tested for genetics? Well, clearly a 95-year-old is not the prime subject in genetic testing. Their life is unfortunately almost over. But certainly with respect to children, it's a very important thing to look at. Why might that make a difference? What's important about genetic testing? Well, if you were going to build a plant in a city and you were going to make widgets, you'd have to know what the plant looks like. Can the plant make widgets? Is the plant properly mechanized? Well, with respect to human beings, it's the same thing. What is the genetics? What's the plant look like? How am I going to respond to various drugs? That has become the subject of genetic testing. And in fact, what we have found is that rather by giving the same medications to every person for the same diseases, doesn't work. If we genetically test up front and we know how those drugs will work in your body, we can actually presuppose, not guess, but actually know what will happen when you take a given drug. That way, we not only save money, but we save all the complications. Why give a drug to somebody at right off the bat when you know the drug could only hurt them? Doesn't make a lot of sense. So genetic testing is very important. Do you need to know if you're going to have a disease? That may be a reason for genetic testing. How a drug might respond, that would be a need for genetic testing. You know, we're all going to get old, that's a fact. We're all going to die, that's a fact. And doctors cannot change that. But we certainly can change the course of illness, and we can help you live better by knowing what your genetics are so that you can make better choices for yourself. Ask your doctor about genetic testing. It can be as simple as a sputum test and sometimes a blood test. Indeed, you can learn more about your risk for heart disease through genetic testing than you can sometimes through a cholesterol. Cholesterol, very important, not going to argue that point at all, but isn't it important to know if you really do have a potential genetic risk of heart disease? Wouldn't you be more inclined to take a medication to treat your cholesterol if you know you have a huge genetic risk? I think so. So if we're talking about affordable health care is about knowing what works. Knowing what works can sometimes be about making a good investment up front. And I think it's an important investment for Americans to make, genetic testing. It doesn't have to be expensive. It can be as little as $500 for a multitude of tests, up to 100 tests. It can be done non-invasively, as I said, through saliva, and it's a good thing to know. Know if you have a genetic risk for breast cancer. That may be the deciding vote that gets you in to get your mammogram and saves your life. Thanks for listening.